Hello, and welcome to my presentation this morning, this afternoon, or this evening, wherever you are. My name is Dr. Ryan Falck, and I will be presenting It's All in Your Head, Neuropredictors of Physical Activity and Sedentary Behavior. So as I'm sure that most of us are aware, there's a crisis in the world today of physical inactivity and also a sedentary lifestyle. What we see is that overwhelmingly there is a large part of the population which is considered to be physically inactive, that is not meeting the current guidelines of 150 minutes per week of moderate to vigorous physical activity. And we also see that the sedentary lifestyle is predominant, with most people sitting most of the day and engaging in sedentary activities and also having sedentary jobs. And this kind of lifestyle is also associated with an increased risk of a number of different chronic diseases, including cardiovascular disease, Alzheimer's disease, dementia, and then also risk of an early death as well. Now, based on this information, we have current guidelines available that I'm sure everybody here is aware of on physical activity and sedentary behavior, namely that all adults should engage in at least 150 minutes per week of moderate to vigorous physical activity, and also limit their sedentary behavior time as much as possible. Now, while we know this information, we have a large amount of information that suggests that these guidelines are effective at helping to promote better health. Most people still fail to meet these guidelines. In fact, less than 10% of all adults met the current physical activity guidelines in 2006, and adherence to the physical activity guidelines did not change between 2007 and 2016. In addition, we also see that for sedentary behavior, the amount of sedentary behavior that adults engage in has gone up in recent years. Now, why this is, we're not exactly sure, but one thing that is interesting to note is that it may be related to self-regulatory capacity. So most people obviously perceive physical activity to be beneficial for health. As we can see from the guidelines, most people are aware of the guidelines and their benefits. Now, with that being said, regular engagement in physical activity seems to require a significant amount of self-regulatory capacity, or the ability to regulate your behavior. And people with a greater self-regulatory capacity are also more successful at implementing physical activity intentions and are more physically active and less sedentary behavior. In addition, most people are aware that too much sedentary behavior can have negative consequences on their health. And while this is true, engagement in sedentary behavior requires little to no self-regulatory capacity. So we don't have to regulate our behavior as much in order to engage in sedentary time, suggesting that sedentary behavior might be a default behavioral pattern. Now, one thing that's important to note is that our self-regulation capacity, as denoted here by this stoplight, may be beneficial for helping to increase our physical activity and helping to reduce or at least maintain our sedentary time. And it's important to note, while they may have some effect in terms of our physical activity and sedentary behavior, it's also worth noting that self-regulation may be related to aspects of our brain as well, or neurocognitive processes. In particular, one area of cognitive function called executive function. Executive function refers to a broad set of higher level cognitive processes that help to maintain our behavior and help to regulate our behavior, such as inhibition, or the ability to inhibit certain behaviors instead engaging in others instead. Now, it's also important to note that physical activity and sedentary behavior are each associated with executive function, such that higher amounts of physical activity and lower amounts of sedentary behavior can help to promote better executive performance. But far less is known about how these behaviors might actually impact how executive function might actually impact our physical activity and sedentary behavior. That is, how do the neurocognitive processes that underlie executive performance impact sedentary behavior and physical activity? So with this in mind, I was interested in looking at the underlying functional neurocorrelates of executive control, which help to predict our physical activity and our sedentary behavior, as well as changes in physical activity and sedentary behavior. And to do this, I hypothesized that adults with greater baseline cortical activation in areas that underlie executive control would have greater amounts of physical activity and less sedentary behavior at baseline, and then also have greater physical activity and less sedentary behavior over a 6-month intervention. Now, for this study, this was a secondary analysis of the Monitor OA study, which was a randomized control trial to increase physical activity and reduce sedentary behavior among individuals with knee osteoarthritis. At baseline, all participants were queried for age, sex, education, and also their osteoarthritis symptoms and pain scale. We also measured physical activity and sedentary behavior using the SenseWear Mini, which was worn on the non-dominant tricep for a period of 7 days, and as I'm sure most of us are aware, is a valid and reliable estimate of physical activity and sedentary behavior. So following this, we then recruited a subsample of 30 individuals who undertook a MRI scan, completing both a structural 3T MRI scan as well as a task-based fMRI scan, namely the now and later task. The way the now and later task works is it's combined of 2 separate tasks. First, the now task, wherein a participant would be shown a picture of a food while in the MRI machine, and then shown the statement now. And during this time, the participant was asked to try and think about how much they wanted the food and how the food would taste, how it would, how satisfying it would be, etc. And it was usually an appetizing food like pizza or donuts or something along those lines. In addition, the later trial was then presented separately in a random order, wherein participants were shown another appetizing food and then presented with the statement later. During that time, participants were asked to indicate or think about how the food would affect their body later on. So if you can see here, this idea would allow us to look at how somebody can inhibit their behavior based on how appetizing a food is. So we're using this as a way of being able to understand somebody's executive performance or look at how somebody engages in executive function within the brain. So following this protocol, participants were randomized into either an immediate intervention group or delayed intervention group. The immediate intervention group received a physical activity and sedentary behavior intervention to try and increase physical activity, reduce sedentary behavior with a physiotherapist, where they engaged in the brief action planning approach in order to help to increase their physical activity and reduce sedentary time. This occurred for the first 2 months of the study, and then we followed up participants at 4 months and 6 months. The delayed intervention group did not receive anything during the first 2 months of the study, then received the intervention from months 2 to 4, and then was followed up from months 4 to 6. Now, as you can see here, there were quite a bit of changes in terms of physical activity and sedentary behavior over the course of the intervention, quite a bit more in terms of individual changes in physical activity as compared to sedentary behavior on average. And then importantly, what we also saw was that greater neural activation in the right anterior cingulate gyrus, as you can see up here in this area right here and over here, was associated with less physical activity at baseline. What this seems to suggest is that individuals who have less executive control would have less physical activity at baseline. However, what we also saw was that there was no association with any brain region wherein that was associated with sedentary behavior at baseline, excuse me. And then in terms of looking at the predictors of physical activity and sedentary behavior over 6 months, what we saw was that for individuals who had greater activation in the right precuneus, as shown right here, these individuals would have greater increases in physical activity over time. And the precuneus is another area of the executive network as well. And importantly, we saw that no brain region was where neural activation occurred was associated with sedentary behavior changes over time. Now, what this seems to suggest is that while physical activity and sedentary behavior are related to each other, we don't really see that there's any single relationship that exists wherein no system seems to be controlling our sedentary behavior, or no self-regulatory system. At the same time, what we do see is that there is a complex neurocognitive system that helps to regulate our physical activity level, suggesting that in order to engage in physical activity, it requires somebody to use top-down control in order to become more physically active. However, what we also see as well is that sedentary behavior doesn't require any such system, suggesting that this is a default behavioral pattern, and thus it may make us more inclined to engage in more sedentary behavior. So with this said, I'd like to just acknowledge all the members of my laboratory, specifically my supervisors, Dr. Teresa Lou Ambrose and Dr. Roger Tam, and also all the other great folks that I work with at the University of British Columbia. Thank you.